Hi everyone, I am Dr. Ravina, NHS Women's Health Doctor, and I'd like to welcome you to this dedicated channel for women's health. Today we'll be discussing COVID-19 and its effect during pregnancy. So this has just taken the media by storm, and there are so many opinions for and against having the vaccine during pregnancy. So what I wanted to do is just lay out the facts for you, the good things, the bad things, the risks, the benefits, what the guidelines are in the UK specifically, and also the risk factors that one person at risk in comparison to another. So if you have any specific questions, feel free to drop them in the comments below or private message me on Instagram at dr.ravina. And I've also got a free women's health ebook that is available for you to download in the description below. And if you're listening to this via a podcast, feel free to check us out on YouTube at Dr. Ravina, and feel free to drop me any questions. So let us begin. So let's first talk about what the guidelines in the UK are. So in the UK, every pregnant woman is offered the first and second, the COVID-19 vaccination. And they'll be offered also the booster vaccination if they are over 18 and it's been 3 months since their last vaccination. So that is the guidance, that is what's currently offered, and whether you wish to take that or not is up to you. It's your decision, it's not mandated, it's not an illegal crime for you not to have the vaccine. It's completely up to you whether you want to have it. But I do think it is very important for you to be aware of the risks and the benefits of having COVID-19 and also of taking the vaccine. So let's talk about what puts one person at a higher risk of catching COVID-19 compared to someone else. So there's a list of different reasons, and I've got all of this information from the Royal College of Obstetrics and Gynecology guidelines, from the NHS guidelines, as well as used some of my own personal experience of seeing women who have been quite unwell with COVID-19 in hospital, in intensive care, and that's where all these resources have come from. So what puts someone at higher risk of catching COVID-19? So here are a list of reasons. If you are living with someone during your pregnancy who works in a healthcare profession, who works in a hospital, seeing COVID patients very often, working in a care home with elderly people, then you are slightly at higher risk of catching COVID. The second thing is you're at a higher rate of catching COVID if there is a high rate of COVID in the community in which you live. So if you're meeting up with people that perhaps are also in contact with people with COVID-19, then you are at higher risk of catching it. And we know there are communities that do have a high risk of catching it due to environmental factors, social factors, living in communal areas. If you're in a house that has lots of people in it, if it's perhaps overcrowded, then that's going to increase your risk of getting COVID-19. And another really important reason why one person may be higher risk is their ethnic background. So if you're Black, ethnic, minority, Asian, and from a community that is a minority, we know there is a lot of data to support the fact that you are at higher risk of not only catching COVID-19, but also suffering from it and being very unwell. So if you do fall in that demographic, you are at higher risk. So it is a good idea for you to get the vaccine. Now let's talk a little bit about, so the next thing I'd like to talk about is in pregnant women, what puts you at higher risk of getting COVID-19 and becoming unwell with it. We know many people get COVID-19 and can be quite well, can be quite functional, don't get too unwell, don't need to go into hospital. But there are people that when they get pregnant are at higher risk. Now pregnancy is a state of having a reduced immune system. So during pregnancy, the risk of you catching an infection is much higher and you're thought to be in a vulnerable group. That's because you are not only looking after yourself, but you've also got a baby and you have less immunity. You're already in a vulnerable state by being pregnant, but some people have underlying health conditions, underlying diseases that puts them at an even higher risk. And here are some of the reasons. So one, if you have an immune condition, so like an autoimmune condition like lupus, like psoriasis, anything like that, that is an immune condition and that could put you at higher risk. Diabetes, high blood pressure, heart disease, and also asthma. And these are all really common conditions and they put you at high risk of catching COVID and being very unwell with COVID-19. Other things are having a high BMI, particularly over 25. So that will push you into the bracket of being overweight if you're over 25, and if you're over 30, that will put you in the bracket of being obese. So we want to encourage people to have a healthy lifestyle, eat well, and have a BMI ideally between 20 to 25, and that will put you at lower risk. The next thing that puts you at higher risk, unfortunately, is age. So we know that having a pregnancy later on in life already increases your risk of issues during pregnancy, issues with delivery, and it can also increase your risk of catching COVID-19 and making you very unwell. So specifically over age of 35 puts you at higher risk. And the last thing is if you are in your third trimester of pregnancy. So this is when, your baby is developed, your baby's just growing. Third trimester is obviously coming towards the end of your pregnancy, but that's why you're at higher risk. Your immune system's really low, your natural defenses are low. So you are at risk of not having the antibodies in your blood to protect you from COVID-19, and it puts you at high risk of becoming unwell and ending up in intensive care. So this is not to scare you, I'm just telling you your risks. So now I'd like to move on to talking about the pros and the cons of getting the vaccine. So let's start off with the bad things, and then we'll end on a good note. So the bad things about having the vaccine. So we know that you can get side effects with the vaccine, just like you can get side effects with lots of vaccines. So you can get injection site reactions, redness, hotness to the area. You can get a sore arm. You may feel like you've got a dead arm for a day or two. That's really common. You can get a headache, a fever, feel really lethargic, feel tired. You might feel like you need to be in bed all day. But those side effects are pretty temporary and they're not going to last too long, and you can get those side effects with most vaccinations. The second negative about getting the COVID-19 vaccine is specifically with the AstraZeneca vaccine, and that is there has been some reports that this is a noted side effect, that you can have an increased risk of clots in your legs, your lungs and your brain with the AstraZeneca COVID-19 vaccination. Hypercoagulable state, which means you are already at a higher risk of getting clots when you're pregnant than when you're not. So then by taking the AstraZeneca vaccination, that will put you at higher risk even further of getting clot. That can manifest as really hot, swollen legs. You may have difficulty breathing, shortness of breath, and that's a sign that you may have a clot. So in terms of having the vaccine, it's ideally not to have the AstraZeneca one, and with the other types of vaccinations, this hasn't been seen to be a side effect. Now let's move on to the positives and reasons why you should get the COVID-19 vaccination. So we know that COVID-19 can be really dangerous, specifically and even more so in pregnancy. And those are for the reasons that you now have two humans to look after, you and the one that you're growing. You have a reduced immune system. You're not producing as many antibodies as you would have in a non-pregnant state. So if you were to contract COVID-19, it would be very dangerous and it would be even more harmful than if you weren't pregnant. Now, the second one is something that a lot of women didn't really believe, but actually over the past couple of years, we've seen this increase dramatically. And that is an increased rate of stillbirth and an increased rate of preterm labor in women that get COVID-19 who aren't vaccinated. And they compared this to women who didn't get COVID. And there is a very noticeable and distinct difference between those that didn't get the vaccine, those that did, and those that had a stillbirth and had preterm labor. So stillbirth is where obviously the baby is almost at term and isn't delivered alive. And having a preterm labour is where quite at term but you deliver early, and that can pose risk to both you and baby. So for baby, if they're premature, their lungs haven't developed to the optimum state, they may have neonatal infections, they may have difficulty breathing when they come out of the womb, and they can have a lot of fluid in their lungs which make it difficult to breathe. So that's mainly due to the fact that they're underdeveloped and their organs aren't developed yet. And the third positive, I guess, of the COVID-19 vaccine is that the vaccine itself doesn't actually contain the coronavirus. There's no virus in the vaccine. The only thing that it contains is the spike protein. And the spike protein is just a protein that is attached to the virus, but instead of giving the virus, we just give the protein, which allows our body to produce an immune system and produce an immune response to produce antibodies against the virus. And that's actually really similar to so many of the vaccines that we give already during pregnancy. So in the UK, we give whooping cough, and we also give the flu jab to pregnant women. And they're both non-live vaccines that contain the protein to induce an immune response. So the COVID-19 vaccine is actually just very similar and works in the same way. So that's a great positive. And there's some research that was done in the US, and it involved 172,000 women, and they all had either the Pfizer or the Moderna vaccine. And then they also replicated the same study in the UK with 100,000 women with also the Pfizer and Moderna vaccine. And they found, they chased these women, so they gave the vaccine and they chased these women several months later during their pregnancy and then beyond after their pregnancy to check on the health of these women, to see if they had any side effects, to see if they had any health concerns, any safety concerns. And they found in this massive study in the UK and in the US, there were absolutely no safety concerns in that study, and there's more information on that study in the Royal College of Obstetrics and Gynecology guidance specifically to COVID-19 in pregnancy. So if you want to read more about that, feel free, and if you have any questions for me, please drop them in the comments below. So that concludes this video. We've covered lots about COVID-19, the risks during pregnancy, the cons, the pros of having the vaccine, and what puts you at higher risk if you are pregnant and you're wondering whether you would be a high risk vulnerable person, and that might influence your decision to get the vaccine or not. So it's entirely your decision, and if you do want to talk to a healthcare professional about the risks in further, feel free to talk to your doctor, because it is a really important conversation to have, and we ultimately want you to be in the best health state possible. So hope you found that useful. And let me know if you liked it by clicking on the like, and share it if you want to share it with any of your friends who are also pregnant or going to be pregnant, and also subscribe for more COVID related, pregnancy related, women's health related information. All the best, take care, bye.